Every 6 seconds, someone in the world dies from cancer. In the time it took you to read that sentence, another family just got the worst phone call of their lives. Every year, cancer claims more than 10 million lives worldwide. And that number keeps climbing. But here is what almost nobody tells you clearly enough. Cancer does not appear out of nowhere. In the vast majority of cases, your body has been quietly sending you warning signals, sometimes for months, sometimes for years long before the disease reaches a dangerous stage. The problem is not that your body isn't warning you. The problem is that nobody ever taught you how to read those warnings. Today, we are going to walk through 5 cancer warning signs your body sends you. Not the obvious symptoms everyone already knows about, but the subtle ones, the ones that are easy to dismiss, easy to blame on something else, and that is exactly what makes them the most dangerous. If you want medical information explained in plain English, no exaggeration, no sugarcoating, hit subscribe and like this video right now. Because our goal is to help you understand your own body before it is too late. And make sure you stay until the end, because warning sign number 5 is the most overlooked one on this list, and the one that cancer specialists worry about the most. Foundation: why cancer is almost always caught too late. Before we get into the warning signs, there is one core truth we need to establish. Cancer is not a single disease. It is an umbrella term for more than 200 different diseases, each originating from a different type of cell, developing in a different way, and affecting the body in completely different ways. But they all share one thing in common. They begin with a single cell that mutates. That cell multiplies out of control, and in the early stages, when the tumor is still small, when the cancer has not yet spread, your body is still fighting back. Your immune system is responding. Your organs are sending signals. The problem is that those signals are very easy to confuse with everyday illnesses. Fatigue gets blamed on a busy schedule. Weight loss gets credited to eating less. A persistent cough gets treated with over-the-counter medicine. And just like that, precious weeks and months slip by. Medical research shows that when cancer is caught at stage 1, the 5-year survival rate for most cancers exceeds 90%. But when it is caught at stage 4, that number can drop below 20%. That is why early detection is not just knowledge, it is the difference between life and death. Warning sign 1. Chronic fatigue with no explanation. This is the most overlooked warning sign on this list, because everybody gets tired. But there is a significant difference between normal tiredness and cancer-related fatigue, and you need to know that difference. Normal fatigue has a clear cause. You worked long hours, slept poorly, or dealt with prolonged stress, and after resting, you feel better. That is normal physiological tiredness. Cancer-related fatigue is completely different. It does not improve even after a full night of sleep. It does not go away even after a week of rest. It is so heavy and relentless that even the simplest tasks, climbing one flight of stairs, taking a morning shower, leave you completely wiped out. So what is actually happening inside your body? When cancer cells grow, they do not just take up space, they actively compete with healthy cells for nutrients and oxygen. On top of that, your immune system is working around the clock to fight these abnormal cells, releasing inflammatory compounds called cytokines. Those cytokines are what create that deep, heavy sense of exhaustion that has no obvious explanation. Blood cancers like leukemia and lymphoma tend to cause severe fatigue very early on, because they directly attack the body's blood cell production system. Colon cancer causes fatigue through chronic internal bleeding that leads to anemia. Pancreatic cancer causes fatigue by disrupting the body's entire energy metabolism. The key thing to watch for is chronic fatigue paired with any of the other warning signs on today's list. On its own, it is already concerning. Combined with other symptoms, that is a reason to see a doctor immediately. Warning sign 2. Unexplained weight loss. If you have lost more than 10 pounds over 6 to 12 months without changing your diet or exercise routine, that is not good news. That is a red flag. In medicine, we call this unintentional weight loss, and it is one of the most classic warning signs that oncologists are trained never to ignore. So why does cancer cause weight loss? The first mechanism is that cancer fundamentally alters your metabolism. Tumors consume enormous amounts of glucose. This is exactly why tumors light up so clearly on a PET scan, because they absorb radioactive sugar far more aggressively than any other tissue in the body. Your body is feeding a massive parasite without even knowing it. The second mechanism is a condition called cancer cachexia, a syndrome of severe weight loss and muscle wasting. This is not simply eating less. It is a complex biochemical process in which the body begins breaking down both muscle and fat for energy, even when you are eating normally. Many cancer patients lose significant weight despite maintaining their regular diet. The third mechanism is systemic inflammation. The cytokines released by the immune system to fight cancer also suppress appetite and slow down digestion. Stomach cancer, pancreatic cancer, esophageal cancer, and lung cancer are particularly known for causing noticeable weight loss in the early stages. But the reality is that virtually any cancer can trigger this response once the body begins reacting to the presence of a tumor. Here is the bottom line. Unintentional weight loss is never a good sign. It always requires a clear explanation. If you cannot explain why you are losing weight, it is time to see your doctor. Warning sign 3. Unusual changes on your skin. Your skin is the largest organ in your body, and it is also the clearest mirror of what is happening on the inside. Most people know that a mole that changes shape could be a sign of skin cancer. But far fewer people know that your skin can also reflect cancer happening in your internal organs. There are 4 skin changes you should never ignore. The first is yellowing of the skin and eyes, what doctors call jaundice. When the whites of your eyes or your skin begin turning yellow, that is a sign of bilirubin building up in your bloodstream. Bilirubin is a byproduct of red blood cell breakdown, normally processed by the liver and excreted through bile. When the liver is damaged by liver cancer, by pancreatic cancer blocking the bile duct, or by cancer that has spread to the liver, that process breaks down and bilirubin accumulates, causing the yellow discoloration. Jaundice is never a normal symptom in a healthy adult. The second is unexplained whole body itching. This sounds harmless, but chronic, generalized itching, especially without any visible rash, can be an early sign of Hodgkin's lymphoma, leukemia, or bile duct cancer. The mechanism is that cancer cells stimulate the peripheral nervous system and release itch-triggering compounds into the bloodstream. The third is changes in existing moles. Dermatologists use the ABCD rule to evaluate them. A for asymmetry, B for irregular border, C for uneven color, D for diameter larger than about a quarter inch, and E for evolution, meaning the mole is changing over time. Any mole that checks one or more of these boxes needs to be evaluated by a dermatologist. The fourth is wounds that will not heal. A healthy body heals cuts and sores within 2 to 4 weeks. When an ulcer, wound, or skin crack persists for more than 4 weeks with no signs of healing, particularly around the mouth, lips, or genitals, that needs to be examined to rule out squamous cell carcinoma. Your skin is talking to you every single day. The problem is most of us are not really listening. Warning sign 4. Persistent changes in your digestive habits. This is the warning sign that most people are too embarrassed to talk about, and that is exactly why it gets ignored the longest. Your digestive tract stretches nearly 30 feet, from your mouth all the way to your colon. Any change along that entire length that lasts more than a few weeks deserves your attention. The first change to watch for is blood in your stool or urine. This is a warning sign you should never dismiss. Bright red blood in the stool is typically associated with the lower digestive tract colon or rectal cancer. Black, tar-like stool with a distinct foul odor usually indicates bleeding from the upper digestive tract, the stomach, or small intestine. Blood in your urine, even a single occurrence, needs to be evaluated to rule out bladder cancer or kidney cancer. Many people see blood in the toilet and immediately reassure themselves that it is just hemorrhoids. And sometimes that is exactly what it is. But colon cancer and hemorrhoids can coexist. There is simply no way to know for certain without a colonoscopy. Do not diagnose yourself out of danger. The second change is an alteration in your bowel habits lasting more than 4 weeks. Sudden persistent constipation, chronic diarrhea, or alternating between the two with no clear cause, especially in anyone over 40, is an indication for a colonoscopy. Colorectal cancer is the third most common cancer in the world, and the cure rate is extremely high when it is caught early. The third change is persistent difficulty swallowing, a feeling that food is getting stuck in your throat or chest, especially with solid foods, that progressively worsens over time. This is one of the classic warning signs of esophageal cancer. Esophageal cancer typically causes no pain in the early stages, only difficulty swallowing. That is why so many patients are diagnosed late. The fourth change is persistent, dull abdominal pain with no clear explanation, particularly pain in the upper middle abdomen after eating, pain in the upper right abdomen, or pain in the lower left back that radiates to the belly. These specific locations and patterns need to be evaluated by a physician to rule out stomach cancer, liver cancer, and pancreatic cancer. Your digestive system should not be causing you daily discomfort if it is your body is trying to tell you something. Warning sign 5. Persistent cough, hoarseness, or unexplained shortness of breath. And here is warning sign number 5, the one cancer specialists worry about most because it gets dismissed the longest. A cough is one of the most common symptoms a person can experience. The common cold, allergies, dry air. There are dozens of benign reasons to cough. That is exactly why, when a cough is a sign of lung cancer, patients wait an average of 12 to 18 months before seeing a doctor. But there are specific characteristics of a cough that you should never ignore. A cough that persists for more than 3 weeks and does not improve after treating common causes is no longer a cold. That is an indication for a chest X-ray at minimum. Coughing up blood even once, even just a few drops, is a medical emergency. There is no safe amount of blood to cough up and wait on. Coughing up blood can be a sign of lung cancer, laryngeal cancer, or tuberculosis, all of which require immediate evaluation. Hoarseness that lasts more than 3 weeks and is not explained by laryngitis or voice overuse may be a sign of laryngeal cancer or thyroid cancer pressing on the recurrent laryngeal nerve. Many patients with laryngeal cancer come in thinking they have chronic laryngitis. Progressive shortness of breath with no history of asthma or COPD, especially accompanied by one-sided chest pain, may be a sign of pleural effusion caused by lung cancer or mesothelioma. Lung cancer is the leading cause of cancer death worldwide, killing more people than breast cancer, colon cancer, and prostate cancer combined. And the primary reason is not that it cannot be treated when caught early. The reason is that most patients come to a doctor far too late, not because they had no symptoms, but because they assumed those symptoms were normal. Before we talk about what you should do next, we need to address 3 widely believed myths that are silently putting people in danger. Myth number 1. Cancer only happens to older people. Completely false. Leukemia is the most common cancer in children. Thyroid cancer and cervical cancer frequently appear in women under 40. Testicular cancer is most common in men between 15 and 35. Age is a risk factor, but it is not a requirement. Myth number 2. If it doesn't hurt, I'm fine. This is the most dangerous myth of all. Early stage cancer is almost always painless. Liver cancer, pancreatic cancer, lung cancer, all of these can progress to stage 2 or even stage 3 without causing significant pain. Real pain typically only appears once the cancer has invaded nerves or nearby organs, which usually means it is already in a late stage. Do not wait until it hurts to see a doctor. Pain is a late sign, not an early one. Myth number 3. Nobody in my family had cancer, so I'm safe. Only about 5 to 10% of cancers are directly inherited. More than 90% result from gene mutations that occur during a person's lifetime from exposure to carcinogens, lifestyle factors, environmental influences, and random chance. No family history does not mean you are immune. It just means you do not have that one specific risk factor. Knowing is not enough. Knowing and acting is what saves lives. Action number 1. Write down any symptoms you have been experiencing and bring that list to your doctor. Not to self-diagnose, but to make sure nothing gets left out when you sit down with your physician. Research shows that the average patient forgets more than 40% of what they intended to say during a medical appointment. Write it down: when it started, how often it happens, how severe it is, and what makes it better or worse. That information is invaluable to your doctor. Action number 2. Ask your doctor about the cancer screenings that are appropriate for your age and gender. For women over 21, a pap smear and HPV test for cervical cancer. For women over 40, a mammogram for breast cancer. For both men and women over 45, a colonoscopy for colorectal cancer. For heavy smokers or former smokers, a low-dose CT scan for lung cancer. These tests are not about diagnosing illness. They are about finding cancer before it causes any symptoms at all. That is the definition of early detection. Action number 3. Ask your doctor about a comprehensive blood panel and whether tumor markers like CEA, AFP, or PSA are appropriate for your risk profile. CEA is a tumor marker associated with colon, lung, and stomach cancer. AFP is linked to primary liver cancer. PSA is a prostate cancer screening test for men over 50. None of these tests are definitive diagnoses on their own, but combined with clinical symptoms and other tests, they provide critical information. Talk with your doctor about which of these makes sense for your specific situation. Do not order tests on your own and try to interpret the results yourself. Cancer is not a death sentence, especially when it is caught early. But early detection does not happen on its own. It comes from paying attention to your body, noticing small changes, and having the courage to make a doctor's appointment instead of waiting and hoping. The 5 warning signs we covered today: unexplained chronic fatigue, unintentional weight loss, unusual skin changes, persistent changes in digestion, and a persistent cough or hoarseness, none of them automatically mean you have cancer. But every single one of them deserves a conversation with your doctor. Do not let fear stop you from getting checked, and do not let a busy schedule become the reason you put it off. Because in oncology, the most valuable resource is not money or technology, it is time. If this video helped you, please share it with someone you care about. Not to scare them, but because this information might be exactly what they need to hear today. Subscribe to the channel and hit the notification bell so you never miss our weekly health videos. And if you want to go deeper on protecting your cardiovascular health and reducing your stroke risk, watch our next video right now. Your health is the one thing money cannot replace. Protect it before it is too late.